at this hour, we're asking the question, is it time to slash down GST rates on health insurance? The Government of India on Monday revealed that GST on health and life insurance generated over 21,200 crore rupees over the past 3 years, with over 8,200 crore rupees collected in the last financial year 2023-24. Junior Finance Minister Pankaj Chaudhary noted that over 3,200 crore rupees came from health policy insurance, reassurance. He mentioned that while some insurance schemes for the poor and differently abled are GST exempt, there have been calls from industry representatives for a reduction or exemption from the 18% GST rate. Meanwhile, leaders of the India Alliance bloc protested outside the Indian Parliament demanding the rollback of this GST rate. Let's first listen to what Congress Party MP Shashi Tharoor had to say.
Point out is that you can't really impose GST on something as essential as life insurance. The government has announced a policy of life insurance for all and health insurance for all by 2047, and now they're taxing in such a way that there will be no possibility of being able to do that.
Sir,
we already, by the way, have the highest out-of-pocket expenses in health, and now you also want to pay 18% GST. It's not fair to people.
Sir, could you...
We need an AIMS in Kerala, which has been promised since 2014, and that's what that extra protest was.
And joining us are Mr. Lokesh Damania, CFO of ClearMedi, and Harsh Roongta, founder, fee-only investment advisor. Thank you both of you for joining us. I want to begin by asking a very simple question. Lokesh, is it just politics, or is there any real merit in cutting tax on health insurance?
Yeah, it is very subjective what you are saying. It is politics or something else. But what I see as a government, if they are looking for the poor people, like they are giving Ayushman cards and 5 lakh rupees, they are funding from their side to for the poor people and other people. So why they are not looking for the common people? Because nowadays, insurance is also a basic need of everyone. After COVID, everybody when see there is a huge gap in the this population and the bed capacity in India. Currently, if we see, almost every year 12% of cancer cases are increasing, 20% of cardiac cases are increasing, and diabetic cases are almost 35% every year. So everybody needs that kind of affordability in healthcare. So if we will give a small benefit to these people, because when we see the statistics, so government already said that we have already more than 200% GST collected during the year. If we can expect these kind of inflow through the GST, so why can't government can look upon and give some relief to the common people to make their life easy, to make hospital bills on time, payments and everything. So this is the basic need what I feel government has to look upon.
Okay, Harsh, if I were to ask you, talk to us, does it only hurt the consumer, or is it bad for the insurance sector as a whole?
I'm afraid the argument is not as clear as, what it is. Politics is the art of making things simple. But, 100 rupees, let's say, is the premium, and that you charge 18%. So 118 is the cost to the consumer. While working out that 100 rupees, the insurance company, let's say, has paid commissions and some other expenses on which itself it has incurred GST. So let's say that is 20 rupees. On that 20 rupees, it has paid a GST of 3.6, which it does not take into account because it is able to set this off against the GST it collects. Now, if the 18% GST is removed, they will have to hike the premium to at least 103.6 to make sure that they maintain their profit margins at the same level as it was at 100 rupees. So, first of all, removal of 18% is not going to mean cost drop of from 118 to 100. It will mean 100 to 103.6 or whatever is that number. Second and biggest impediment, according to me, is that the insurance industry does not have a great track record of passing on tax benefits to the consumers. The example I gave you, Plus, if you look at the life insurance industry, they have been blessed with tax breaks. And what have they done with that tax breaks? They've used that tax breaks to give high commissions and make high profits. Ultimate consumer has not benefited. So I think I do not, I am not saying I'm against this thing about giving exemption on GST. I'm just saying that you need to take other things into account. That's one. And the second thing that we need to think about is that this is not the only essential service that is being taxed, right? We have life-saving medicines, life-saving equipment, plenty of things that are essentials on which the GST is being paid. So this demand isn't going to stop at life insurance premiums or health insurance premiums. Obviously, if this is conceded, there will be snowballing demands. Again, I'm not against it. That's not really my area of expertise. My point only is that there are more things to consider than just plain simple reducing cost from 118 to 100. And on how many items will you make this exemption? What will be the impact on overall collections? I think those things need to be considered as well before this demand is conceded. That's my only point.
In the government's defense, there is also the Ayushman Bharat scheme, which means that the more vulnerable are indeed subsidized. So this particular 18% GST then affects only the middle class. And considering the rising middle class anger in terms of taxes that they have to pay, from income tax to all the other taxes, where does that argument fit in? Harsh.
You're asking me?
Yes.
Okay. So yes, I mean, we in terms of the taxation, obviously the middle class bears the brunt of taxation, especially the salaried middle class, because neither can they escape income tax, nor can they escape GST, because every time you purchase, and now given the fact that the industry, we are more and more, formalized economy, and not paying GST does not make sense in a chain economy that we have become.
Right.
And that's a very good thing. So I think the incidence of taxation is very high. And I think a good way to look at tax relief would be that taxpayers have rewarded the government with better compliance. And should we not bring down overall rates, whether they are income tax, whether they are GST, rather than doing it in bits and pieces? I think this needs to be considered by experts uh, rather than do it sector wise. That is my sort of a very preliminary view. And it requires, I think, much greater thought before these decisions are taken.
Fair enough. Harsh Roongta there of Fee Only giving us that perspective. I'm afraid we've completely run out of time here on the show. With that, thank you, Harsh, for taking time out to be with us here on Newsline Live. Hope to keep having you again and again. With that, it's a wrap here from my side. Thank you so much for watching. This is Krishnakumar signing off.